What's up, everybody? How y'all doing out there? To my peeps everywhere, what's up, what's up, what's up? Y'all know how we do it here from Bowman Live. So I found an article about the cost of vaccines in Fast Company. So let's get right down to it. So let's talk about this for a moment. According to Fast Company, the headline reads, Getting a COVID vaccine could now cost up to $200. Here's what you need to know. The CDC's program to help up to 30 million uninsured Americans get free vaccinations has come to an end as the virus continues to kill thousands each year. The Bridge Access Program, a measure by the Centers for Disease Control and Prevention, or CDC, to help uninsured and underinsured Americans get free COVID vaccines, has come to an end. That means that for some low income individuals, the once free shots now cost around $200. The various strains of COVID are still circulating, and the virus is still to blame for thousands of deaths each year. In 2023, it was the 10th leading cause of death in the United States. Still, fewer and fewer Americans are staying up to date with the latest COVID vaccinations. And with the program ending, it seems likely that the numbers will continue to trend downward, given that low income people who are not insured will have to decide if paying for the latest jabs is worth the risk. Here's what you need to know. What is the Bridge Access Program and how many people used it? The Bridge Access Program provided COVID vaccinations at no cost for the 25 to 30 million living in the United States who now have no health insurance or those whose insurance didn't cover the shots. It was easy to access by scheduling appointments or walking into pharmacies or health centers that participated in the program. Around 34 million COVID vaccines were given to adults in the U.S. last year, and of those, the Bridge Access Program helped fund 1.5 million people. Why is the program ending? Pandemic era funding for the Bridge Access Program expired in August 2024. Are Americans still getting vaccinated against COVID? According to Pew Research Center, vaccine numbers have been dwindling. As of March 2024, just 28% of Americans were up to date with COVID vaccinations. By comparison, in July of 2021, 69% were fully vaccinated. What other options do low-income Americans have to stay safe? Notice they keep talking about, let me just read the article. According to the CDC, or the Center for Disease Control, there are other ways low-income Americans can potentially get free or low-cost COVID vaccines, though none of them are a sure thing. One is a plan that the Biden administration has laid out for next year. Quote, the Vaccines for Adults, or VFA program proposed in the FY 2023 and 2024 presidential budgets would be a long-term solution to ensure all adults have access to recommended vaccinations, including COVID-19 vaccines at no cost to them, close quote, the CDC website states. The CDC also announced a plan to allocate $62 million for state and local health departments to buy vaccines for those in need. Therefore, uninsured and underinsured people should, in theory, be able to find locations to get free or low-cost vaccinations. However, the CDC hasn't yet laid out a plan for how those shots will be distributed. What about kids? According to the CDC, children whose guardians are underinsured can continue to get vaccinated through the Vaccines for Children's program. According to the CDC, the program prevents an estimated 472 million illnesses and 29.8 million hospitalizations and saves about $2.2 trillion due to prevention. Who could be most impacted by the program's end? For many people who have insurance, nothing will change, as most insurance companies will cover COVID shots. However, for low income Americans, and especially, of course, you know what I'm going to say, us, us are always the worst of the worst. No other ethnic marginalized group, no other group can get sick but Black Americans, who have already been disproportionately impacted by COVID. All Americans have been affected by COVID, and not just Black people. So I'm going to debunk that myth right now. It's not unlikely that viruses will rise if it becomes harder to access vaccinations. In 2021, Black Americans were also more likely to contract COVID, BS, and more likely to require hospitalization, another BS. While the gap closed, the COVID rate shrank in 2022. It says Black Americans died at a higher rate of 0.100,000 people compared to 58.6 for white Americans. That's a bunch of BS. Get the hell out of here. Straight up. Straight up. I'm just going to put it that way. It seems like whenever any type of pandemic arises or any influenza or disease comes in to any nation, county, or city, it's always Black people who are supposed to be affected the most. That is an outright lie. I know people from other ethnic groups who have been affected by COVID and who have gotten sick, very sick, and they weren't Black. Know that for a fact. Take care of yourselves. Make sure that you're healthy. Never surrender. Never quit.